back to the Morning Blend. This year marks the 25th anniversary of America's health rankings, which determine which states are the most healthy and which ones need to improve. So that begs the question, how did Nevada do this time around?
Here to shed light on that is United Healthcare of Nevada Chief Medical Officer, Dr. Lorene Tibaldi. Good morning, welcome.
Good morning, thanks for having me.
Our pleasure. So the study is out. Tell us about the health rankings.
So America's Health Rankings is a great report that's sponsored by the United Health Foundation. This is really the only report of its kind, and it's been issued for the past 25 years. So we're very fortunate to be able to have this information state by state. And the great news about the report overall for the whole country is that we're getting better. So life expectancy is up. Death from cardiovascular disease is down.
Wow, great.
Infant mortality is down. Cancer deaths are down. So this is the really, really great news and the trend that we've seen over the last 25 years.
Now, of course, we're a little competitive in Nevada.
We are.
How did we do?
So Nevada came in at 39.
Okay.
We actually dropped 2 spots from last year. So we definitely aren't the worst, but we do have opportunities for improvement.
Yeah. And we have a graphic of the strengths and weaknesses here in Nevada, so we want to pop that up and show it to people. So our strengths are?
So our strengths are in the fact that we're pretty active. We have low rates of physical inactivity. We like to get out and exercise, so that's a really great thing. We also have low rates of obesity when we're comparing.
One thing goes into another, yeah.
Right. So when we look at the rest of the nation, we are lower. So those are definitely positive things for us as a state.
But the negatives that we saw there, though, come in these smoking and drug deaths and immunizations as well.
Yeah, we're actually not so good in immunizations when we compare ourselves to the rest of the country.
Isn't that required by law in school for kids?
So there are requirements for immunizations, and I would encourage all of the parents out there to make sure that you get your child to the pediatrician and make sure that your child is on track for the immunizations.
And what are those things that they need to get shots for as they get older?
So some of the more common things are the measles vaccine, the diphtheria, tetanus, pertussis, and there's definitely a schedule for that. I know my son is 7, so we have to stay on top of that.
Yeah.
He gets a flu shot every year, even though he certainly doesn't enjoy it. But definitely we want to keep our kids healthy, so that's something we can definitely improve on.
And those are things that could spread like wildfire if everyone doesn't do their part and get immunization.
Absolutely. And you know, one thing about this study is that we have individual responsibility for our health. So that's definitely a big part of the ranking. But some of the other issues with the ranking are environment. So some of the things about our environment that cause us to have a lower ranking are the low high school graduation rates.
Huge.
Unfortunately, we're 50th in the nation for that. And that contributes to our overall health.
Yeah.
So that's something we can definitely improve on. The other bad thing is that we do have a higher incidence of violent crime. So that contributes to our lower health.
As you look at the crystal ball and look ahead, do you see Nevada ranking higher next year and making improvements again?
I think we should be optimistic. I think one of the things we can really focus on is access and availability of health care, and that's something that's really being discussed right now. One of the big issues is access in creating more physician availability. There's big talks right now about creating a medical school to be affiliated with our university.
Which would be great.
So I'm really excited about that.
Yeah, and there are things that Nevada can do to address these key challenges that we have, including that medical center. So it's great, great knowledge. If we want to take a look at the rankings for ourselves, how do we do so?
So it's available online. AmericanHealthRankings.org. So folks can go online, check out Nevada's stats, and check out the other states and see how we compare.
On the weakness that we talked about, which is smoking, those are things that people can get help for. There is...
Oh, absolutely. United Healthcare has some great quitting smoking programs.
Cessation programs,
And one of the good things about the upcoming year is that some of the co-pays for the various anti-smoking medications have gone down or disappeared for the prescription type medication. So we do have some positive changes for 2015 with respect to that. And we also have support groups for some of our insurance plans. So it's definitely something that if you're motivated, the help is out there.
Absolutely. Great knowledge. Thank you so much.
Thank you so much.
Thank you.
Nevada ranks 39th among states in overall health. The United Healthcare of Nevada wants to help improve that ranking for next year. You can check out the full list of rankings by visiting the website or right there on your screen. Still to come on the